What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, testing negative for the viruses, and having a great day so far. It is time now for the Thursday edition of the Virus Update for Thursday, September 4th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed of what's going on with these viruses. I find any news, data, wastewater, really anything I can find to help keep you safe and informed of what is going on. Want to stay informed? Just subscribe down below. If you like today's video, please consider giving it a thumbs up. The more people that do that, the more it helps us in the YouTube algorithm. Let's try for 150 like button hits today. Share this video with anyone you know. Hit that notification bell. And of course, leave your comments down below. And if you would like to support the channel, there are ways to do that down below. Already, we do have several news stories today. Some of it being weekly updates. Plus, we are going to talk about, yes, more school illness. That tracking thread, it's growing. I know the school year is so young, but already school illnesses are a problem. We have some very important data from CJS today. You really don't want to miss that. Some states are just, wow. When it comes to this summer COVID wave, yeah, it's just really bad. We do have our weekly update from Ohio. We have New York State, which does include New York City. We're even going to look at the New York City dashboard. And somewhere we must look at for wastewater, which is not good. All right, starting off with Dennis the COVID info guy. New South Wales respiratory surveillance reports. Week ending August 30th, 2025. The COVID positivity rate is stable at 3.9%. Number of laboratories reporting is 2 out of 4. COVID, 1,470 new cases. Hey, that's down by 3%, but the good news stops there. Influenza, 6,926 new cases. And unfortunately, that is up by 2.9%. RSV, 1,543 cases. That is up by 3.1%. The NB.1.8.1 subvariant of COVID is estimated to be 73% of the cases. This is as of August 16th. XFG is 12% of the estimated cases at this time. And again, 2 out of 4 laboratories reporting, but all wastewater regions when it comes to COVID. Look at this. All 4 of them are dropping at this time. So that is some good news. Moving on to this. In Wales, homeschooling almost triples since COVID. Yeah, wow. A total of 7,176 children in Wales were homeschooled last year, the highest number on record, compared with 2,517 in 2018 to 2019, although this is less than 2% of children in Wales. Again, a number that is rising at this time. Over in Arkansas, they are seeing, this is in the United States now, Arkansas is seeing a late summer spike in COVID-19 cases. And yes, the positivity rates and emergency department visits have been going up. So, yes, and take a look at this. The CDC said that across the states of Arkansas, Louisiana, Texas, Oklahoma, New Mexico, there has been a 17.9% rate of positive tests. Think about that. Not enough people testing, plus cases. They're up right now. We got to get these numbers down. That is just not good whatsoever. Wow. Yeah, bad numbers. Measles infected resident exposed at emergency department, 2 other New Jersey facilities. Yes, we're talking about measles once again, this time in Bergen County, New Jersey. A Bergen County resident with measles, a highly contagious and sometimes fatal virus, visited a children's emergency room. Yes, yet again we're seeing measles. I think measles activity is actually starting to pick up again in the United States in the last few years. I don't know. Does it seem like I'm starting to share more measles news stories again? I think it is. There will be a thread, or a post, I should say, with all of today's news stories. I'll make sure this gets into the measles thread as well. That way you can read all the exposure points. We don't sit here and read all that. Our videos would be extremely long. All right, another measles story. This time a school. Yeah, back to school's not going great. School in Virginia Beach reports case as Virginia Department of Health confirms case in Eastern region. That's right, a school in Eastern Virginia is dealing with a case of measles. It's the Trentwood Elementary School. Yes, they're sending notifications to parents via email that, hey, measles, there was a case. And the onset is August 26th. So, yes, hopefully one does not equal another case, because we've done this math so many times. 1 plus 1 equals 2, 2 plus 2 equals 4, 4 plus 4 equals 8. You get the idea. It's getting a little tiring going through this state after state, but here we are. All right, moving on. And just think, some states don't want it to be mandatory. Florida doesn't want childhood vaccines to be mandatory. Measles, that's a big one. I mean, come on. I mean, we've seen the data. I showed you some of the data yesterday. When we take a look at the data, the majority of the cases are in the unvaccinated. Those who were vaccinated and got measles, chances are it's someone who was vaccinated many decades ago, so their immunity may be worn down a little bit, and that's what caused them to catch the case. Maybe someone else in the family had it. It's very frustrating. It really is. Alrighty, moving on to this, something else that's frustrating. Whooping cough cases rise in northern Nevada, health officials say. Just basically want to read a headline there. I'm not seeing the actual number here. I'm seeing many different numbers posted, but not the actual total case count for the year. Is it 18 or is it 19? There's also, I believe it may be 18. You get the point. Measles, I'm saying measles. Whooping cough is rising in Nevada. We talked about New Hampshire yesterday. I mean, each week we're talking about somewhere when it comes to whooping cough. It's actually rather silly. Here's that school illness tracking thread. Yeah, take a look at this already. Actually, let's refresh this. Already, it is growing. We're going to hit page 2 pretty quick at this rate. Yeah, it's not a good thing whatsoever. It's already approaching 1,000 views, so clearly there's interest, meaning people know of someone who is dealing with a problem at a school. Take a look at this. United States measles cases in 2025, 1,431. I thought maybe we had an update to this. We don't. And I just remembered we do have another update that we need to take a look at. Let's refresh this. The UK. I did not set this up for today. I forgot today is the UK day. Let's see what's going on there when it comes to COVID. There's influenza. What we want to see is COVID. Here we go. Uh-oh. I'm seeing a problem. I'm seeing... Yeah, positivity rate may be going up again based on the chart I just looked at. Look at cases, 1,346. That is down by 95, but deaths, 52. That is up by 11. Healthcare usage, 819. That's up by 22. And let's go down here to take a look at this. Yeah, take a look at the positivity rate. It's now up to 9.25%. Yikes, that's not good. Alrighty, moving on now. Let's take a look at what's going on with air qualities. Someone made a comment yesterday about how the air quality is really bad in the Northwest, but also is COVID. Yeah, there have been some, I believe there have been a few studies out there about that. When there's bad air qualities, it doesn't go well with COVID. And wow, take a look at this. You're seeing the maroons, you're seeing the reds, you're seeing purple. And some of that is now spreading into portions of the plains. Yeah, things are not going good for air qualities in the Pacific Northwest. If you have to go out, please consider masking, because this is essentially, you're just essentially walking into smoke at this time, and it is just not good whatsoever. Alrighty, moving on. No, we're not going to look at the smoke model today. We will take a look at the bird migration map. Let's see how many birds migrated. You know, the migration of birds does potentially lead to the spread of bird flu. And take a look at this. Last night, yet again, a really huge migration. Over 400 million birds at the peak migrated last night, and you can see a really strong migration across portions of the Great Lakes. So yes, birds are starting to migrate south. Yes, south for the wintertime. I know, just a few months ago we were talking about birds migrating to the north. Pinellas County, Florida, still seeing a lot of sick person calls. 1, 2, 3, 4, 5 of them. Yikes, that's not good. And Florida overall is still not doing well for COVID. Yeah, I'll show you that in just a moment. Philadelphia on Wednesday had 762 EMS incidents. Taking a live look at Montgomery County, Pennsylvania, shows there are a ton of calls right now. I'm seeing vehicle accident listed several times. And I'm also seeing a lot of vehicle accidents here. Wow, that is pretty bad. Taking a look at this, let's see what's going on in Chester County. We do see sick person listed there. We also see stroke and some other calls. Bucks County, Pennsylvania, what's going on there right now, and we do see 8 active calls there at this time. Now taking a look at the hospital situation in Pennsylvania, and let's refresh this just to make sure this is up to date. Been seeing a number of scattered hospitals today dealing with problems. One of them being out there in Fulton County Medical Center. That's dealing with a trauma issue, and there's still an issue going on at WellSpan Gettysburg. Lancaster's having an issue. Reading, Pennsylvania's having an issue. There's an issue over in Bethlehem, Pennsylvania at St. Luke's Anderson. And 2 hospitals in southeast Pennsylvania are dealing with issues today as well. Now take a look at New Jersey. And this may have changed, but a few minutes ago there were 4 hospitals. Let's see here. Cooper University Hospital, full and total. Diverts, that's for patient volume. Then we come down here to Inspira Medical Center Mannington, has a specialty issue. Inspira Medical Center Malka Hill has an issue. That's 3 hospitals. Psychiatric issue at Penn Medicine, Princeton Medical Center. That's 4 hospitals. And wow, Virtua Voorhees Hospital, patient volume 25 holding in the emergency department and 20 in the waiting. Wow, that's bad. So 5 hospitals in New Jersey today are dealing with problems. All right, drum roll, please. Let's take a look at New York City. Total daily average cases, 330. Hospitalizations, 14. And total deaths, that's daily average hospitalizations. The total number is actually higher. Deaths, just 1 average per day, so they are still seeing deaths. New York State reported 550 cases today. When we take a look at the total New York State hospitalizations, 429 and 40 in the ICU. And when we take a look at New York City, for the total number of hospitalizations, which it will show here, it is going to show you that New York City currently has 205 people in the hospital and 23 people in the ICU at this time. Alrighty, Ohio. Some slight good news here. RSV, down. 4 people hospitalized for that. 9 for flu, that's down. COVID is flat versus the previous week, meaning there could potentially now be a peak in the summer surge of COVID in the state of Ohio. 202 people hospitalized for COVID in Ohio. However, that does not reflect what wastewater scan is showing for the Midwest region. Take a look at this. Yes, wastewater scan is showing a significant rise in the Midwest region of the United States. There is a reason why it is showing that, and let me show that to you if we can. Let's go over to the Detroit metro area, just north of there, Warren, Michigan. Yeah, take a look at this. This is kind of messing with things. Warren, Michigan is just literally going straight up. I think that's going to get corrected, but treat it as if that is the case there right now. And when we take a look at Jackson, Michigan, yeah, not great there either. That's slowly going up. We go to Ann Arbor, Michigan. You'll see there is going up as well. So Michigan as a whole, we're not going to go to every wastewater site in Michigan, but yeah, Michigan's not doing so great right now. Yikes, yeah, that's bad news for Michigan. Alrighty, let's take a look at some data now from CJS and see what he has to say, and there's some pretty bad numbers here today. First off, before we take a look at his numbers, let's pause and take a hydration break. I know I'm going to need it before reading all this. Now we're not going to read it all, but we're going to read most of this. Today's drink of choice is water. Of course, water is great for keeping yourself hydrated. Alright, he did do a few midweek updates, but he also did some 4-week COVID count, which will really give you a sense of what's been going on with this summer wave. First off, it is worth noting that Maryland's cases this week have gone up by over 50%. Virginia, they went over 4,000 cases this week. All right, Tuesday numbers. Florida, daily number, 1,635 new cases. New York, a daily 4-day update, 2,811 new cases. Puerto Rico, still 978 cases there. They're still close to 1,000, at least on Tuesday. Maine, 186 new cases. Texas, my goodness, 7,072 new cases, a 36.5% increase from the prior week. 965 CDC reported hospitalizations and 24 deaths reported by the CDC data tracker. Places like Florida, Texas. Usually we talk about a peak for you in August. Here we are, September 4th. No peak just yet. Yeah, this seems late this year for some of these states. Ohio, which we showed earlier, that is about right on time for their peak. But Virginia, 4,199 new positive tests, 4,069 for the week of August 24th through the 30th. 109 CDC reported hospitalizations and 10 deaths reported by the CDC data tracker. Wednesday numbers. Florida, over 2,030 new cases. New York, 653 new cases. Puerto Rico, daily number, 1,190 new cases and 10 new deaths. Based on recent patterns, this figures to be their death count for this week. Again, they're over 1,000, another 1,000 cases. That's bad. Maryland, also bad. 1,898 new cases, which is a lot for that state. Again, that is a weekly number from Maryland. 52.5% increase from last week. 108 CDC reported hospitalizations and 4 deaths reported there this week. Washington, weekly number, this is Washington State in the Pacific Northwest, 828 emergency department visits and 7 new deaths. All right, here's some of those 4-week COVID counts, encompassing the reporting period from August 2nd through to the 29th. Arizona had 8,303 cases, 479 CDC reported hospitalizations, and 18 deaths reported by the CDC data tracker. California, at least, and mind you, these are just estimates, not including the at-home test and all those people who don't want to test. Oh, it's just the sniffles. It's just a cold. It's just a cough. You know, all those people. I'm not making fun of anyone who coughs. It's something I deal with every morning, but you get the idea. California, 31,921 positive tests, 4,633 CDC reported hospitalizations, and 133 state-reported deaths. Bad month in August for California. Connecticut, 1,536 cases, 176 CDC reported hospitalizations, and 4 deaths reported by the CDC data tracker. Hey, only 4 deaths in 1 month. But, we can go somewhere that's worse than California. You know where that is. It's Florida. The state that doesn't want vaccine mandates for kids anymore. The COVID one, okay, I'm not terribly concerned that they don't want to mandate that for kids, but measles? Come on now. And a few whooping cough vaccine, there's a few of them that's just like, hello, it's a no-brainer. Here we go. 46,776 cases, 4,778 CDC reported hospitalizations, and in the month of August, Florida recorded, 295 state-reported deaths. Some of those were from past years, but again, they've added to their grand total by 295 in Florida. Yeah, the deaths are still a thing with COVID. Hawaii, 3,243 cases, 313 CDC reported hospitalizations, and 12 deaths. Indiana, 3,047 cases, 384 hospitalizations, and 8 deaths. Kentucky, 4,036 positive tests, 287 hospitalizations, and 11 deaths reported there. And where are we at now? Maryland, 4,693 cases, 459 CDC reported hospitalizations, and 16 state reported deaths. Minnesota, 2,515 cases, 208 CDC reported hospitalizations, and 42 state reported deaths. New Jersey reports 4,440 cases, 717 CDC reported hospitalizations, and 24 deaths. New York, 18,526 cases, 1,544 CDC reported hospitalizations, and 53 deaths. Puerto Rico had 23,349 cases, 652 CDC reported hospitalizations, and 37 deaths. Texas, another bad number, although Puerto Rico was pretty bad. Here's Texas. 22,857 cases, 3,304 CDC reported hospitalizations, and 102 deaths reported by the CDC data tracker. I should add that these numbers, we're talking about 102 deaths in 1 month. There was a time, just not too many years ago, we would be talking about that in a week or even just a day. So we have come a long way, but we haven't come far enough. We need to do better. We need to do a lot better. Virginia, 11,139 positive tests, 475 CDC reported hospitalizations, and 27 deaths. United States, USA, 29,837 CDC reported hospitalizations, and 959 deaths reported by the CDC data tracker over the past 4 weeks. I want to bring to your attention that this is summertime. We just talked about COVID. 29,837 CDC reported COVID hospitalizations in a summer month. You don't talk about that with flu, and you also don't have near 1,000 deaths of flu in a summer month either. And he also wants to mention the following, that the COVID situation in Florida is still so bad that Florida has endured more COVID deaths since just after Memorial Day, 621, than California, with a much larger population, has since St. Patrick's Day, 570. And this is not reported deaths, but rather time-stamped deaths, meaning there are no data dumps of any kind involved with this, and both of these are state-reported counts over the particular period mentioned. Florida, you are totally ridiculous. Some other states are still pretty, but Texas, that's not good. Alrighty, folks, that does it for the Thursday edition of the Virus Update. If you enjoyed today's update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, leave your comments down below. Of course, ways to support the channel are listed down below, and of course, I will see you again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday afternoon. Thanks for watching.